And welcome back to Underground Antics. Today we have a very special guest. It is the wonderful Katherine Hambleton. Now, I'm very excited about our conversation today. You know, we have so many things to talk about. Actually, when I was thinking about the introduction and how to properly introduce you, I was listening to, and like you were on We Are Warriors, that podcast. Mm-hmm. And when you were asked to introduce yourself, I really liked that. Like the first thing that you said, you were like, oh, well, you know, I'm a mom and a wife and I have a lovely family. And that's sort of how you defined yourself before you got into like, oh yeah, I mean, I'm also, you know, like an emergency care medicine nurse and a paramedic, and I teach this and I've written books and I've done these lectures and all those other things. You're like, yeah, that stuff's fine, but you know, I'm just a person. So I wanted to bring that into our recording today because I thought it was really nice. So thank you very much for coming on.
I appreciate it. Thank you for having me.
You're welcome. It's very exciting. So you've been in the healthcare and paramedicine space for, 2 decades now or something like that?
Almost, yeah, coming up on two decades. It's hard to believe, actually, when you think about it. It feels like I just graduated from nursing school like a couple years ago. That's an exaggeration. No, definitely.
Yeah.
Sorry?
Yeah. No, I was just going to say, did you go to nursing straight after school? Was that like your first path?
Yeah, so when I actually kind of took a break during high school rather than what a lot of other people do is take their break after high school to figure out what it is that they want to do. And so when I went back to high school, I started to pursue courses that would allow me to get into that program, because what was happening at the time is my mom was she had gone back to school as a mature student and kind of guided me down toward that path. So I thought, okay, this is something that is interesting. I didn't really have a passion for it at the time, but I did make sure that I had all the required courses to get into the program and started off with that.
Right. All the science and math and all that kind of stuff that make you do, the fun things. And so when you started in nursing, where was your first, where did you go first? Did you go into emergency medicine straight away?
No, when I started nursing, there was very limited jobs available. We were very lucky to get part-time around 20 years ago where I was applying. And I wanted to stay local. I wanted to stay in my community, which is in Peterborough back then. And in order to do that, I did my preceptorship and started working part-time on a medical unit. And within 6 months, I was covering both sites. I was doing charge at one site, so I was in charge of the department at the one site, and then working, part-time both sites. But it wasn't until about a year after I had started my career that I began to pursue my path in emergency medicine. It was after a really dynamic community experience that I had with a family member.
Right. What had happened?
Well, when I was so first year of nursing, about a year after I had started working my job, my grandmother got sick. And so part of that, because of my nursing background, I was asked to help to take care of her. And so I would take her to different appointments and I would help schedule, she had cancer. And so I was helping to get her scheduled to all of her appointments. And the weekend before her scheduled surgery, she went into pulmonary edema, which is when her lungs fill up with fluid. And so I was in a different city at the time and about half an hour away, and I got there as soon as I could. And when I got there, she had just passed away. And so that was a really difficult experience for me, because I was, trying to manage, being a new nurse, right? A lot of new nurses, they don't do CPR on a real person for the first little bit, right? So it's not something that's common. And so I started to work her, do a resuscitation on her, and the paramedics came and we worked together to try to resuscitate her. And unfortunately, we were not successful, but that experience pushed me to pursue, a career in the emergency field.
Right. Yeah, I'm sure that must have been really hard, particularly because you were kind of already in that field and, it just, sometimes it doesn't matter. If the timing
Yeah, and
doesn't end up working, it's rough.
exactly, exactly. And it's interesting because here we are, almost 20 years later, and I look back on that experience, and because for the longest time, I told myself that the paramedics that were involved in that call were inspiring to me, and they're the ones that inspired me to go into paramedicine. And in the meantime, before I went to school to be a to get my paramedicine, I started to, pursue different courses. So I took the Advanced Cardiac Life Support Instructor course, and I was doing all these different programs and certifications that were related to resuscitation. And at the time, when I started pushing myself down this path, I thought that it was because I was so inspired and this is what I wanted to do. And it was such a, even though it was a sad situation, it was such a, positive thing for me to focus on, not really recognizing until, years down the road that I was actually pursuing that because I couldn't save my grandmother. And so I wanted to make sure that I saved everybody else. So that's been a really interesting point of, reflection to go back upon, after I've had many years under my belt and, I've gotten a traumatic stress injury as a result.
Right. Yeah, I'm sure. I mean, especially that it comes so later on and it wasn't how you originally had thought it was going to be, and
No.
it's pretty crazy. Do you think that like a lot of people in health professions particularly have some kind of incident that inspires them to go there? Like, do you think that happens a lot?
I would say for a lot of people who are in any sort of public safety type role, so whether it be policing, firefighting, paramedicine, corrections, there is some sort of, not for everybody, but there is some sort of precipitating event that does happen, whether it is, a family member gets sick, or maybe they've grown up in a house that has some dysfunction in it and they want justice to prevail. Like, there's lots of different reasons that project these people into these types of professions. And in nursing, I find that there is some people that do that, but other people want to do it because it's a family thing. You see a lot of sisters and mothers in nursing. And so it is something that is we know that there's going to always be a need for healthcare. So it's almost a guaranteed position, so
Sure.
it brings about lots of different reasons, I guess.
Yeah, and nursing are very much the unsung heroes of the medical industry, I would say. Often overlooked, underpaid, overworked, as they say, unfortunately, because of the amount of, value that they add and the expertise that they have and the knowledge. It's all great. In my family, I have some like people in the medical field and that kind of stuff, and that was always one of the things that we learned about was that. But so you spent some time working in nursing, and then you moved into emergency, the emergency ward, I guess you would say.
Yeah, went to the emergency department. My mom was actually working there as well, and so I got to work for a period of time with my mom, which was really cool.
Oh yeah. How was that?
Yeah, so I worked. It was. Cool. The emergency department is such a dynamic environment.
Right.
And I've worked in two different emergency departments. One in a smaller city and then one in a metropolis, and so it's completely different, the type of care that you would be providing from one place to the other, because in the country we would see, if it was a gunshot wound that would come in, for example, it was usually because there was some hunting accident that had happened or somebody's BB gun went off, and so it was more your farm type incidents, whereas working in the metropolis, you're actually having people who are victims of homicide, attempted homicide. It's just a totally different dynamic with the gunshot wounds, and you don't really see, well, back then we didn't really see a lot of stabbing, so that was kind of a new dynamic. But the emergency department can be anything from bumps and scrapes and bruises all the way through broken bones to, someone having a baby to somebody passing away, and car, like everything that you could possibly imagine comes into those departments.
That's true. It's very interesting how that there's such a difference between like the, more country side of things versus the big city life. And I guess I mean, I would just guess that part of the reason is just the number of people that are around, right? Where in the country it's less people, and so the accidents and those kinds of things are what people usually come in with. There's much less crime, there's much less, people on people violence and things like that, and so it certainly changes. But I mean, listen, I imagine that being in the emergency room is, a weird experience a lot of the time. I'm sure you've seen, or people have come in with, you're like, how did this, what are you doing? Like, why did this happen to you? Do you have like memories of things like that?
Oh my gosh, so many of them. But I'll tell you one.
Let's hear some.
I'll tell you one of my favorite ones, because
sure,
when you're working at triage, so when you come into the hospital, one of the first things that you do is you go to see the triage nurse, and you talk to the triage nurse about what's going on with you, and the triage nurse will decide based on your vital signs as well as your story what part of the department that you will be going to. And so I was triaging one night, and this couple had come in, and the wife came to the desk, and she started to talk to me just about how, her husband couldn't sit down, and he didn't really want to come over and talk to me. And I said, well, I'm really sorry, but I need to get a bit of more information from you so that I can appropriately place you. And so
yeah.
So she pulls him over, and I said, okay, why don't you take a seat? And he's like, I can't. And I was like, oh, okay. He didn't look like he had anything going on with him. And so I asked, I said, well, why are you having trouble sitting? And he said, well, because I have something up there. And I was like, cool as a cucumber. I'm like, so when you say up there, which up there do you mean? Right? Because there's, people come in with all sorts of things and all sorts
there's
of
orifices.
Some options, there's many. And so anyways, long story short, the gentleman, I guess him and his wife had been, playing around in the bedroom, and the dildo that they were using got stuck up inside of his rectum, and he wasn't able to sit down because it was, not only was it painful, but it was, it was also painful and giving him pleasure at the same time. So it was a little bit of a bizarre one for me. And then I have another.
And you got to be there, sure. Like, oh yeah, okay. You got to be all totally, like professional about it. You got to be like,
straight faced and
that's interesting.
Yeah,
in your head, you're like, what?
Well, by that point, I think that I, triaged a lot of patients who had stuck things up their bums or had things stuck up their bums. So it wasn't. That exactly
is a common thing for people.
Time. It is actually. It's funny.
Surprisingly,
we had a young man. Well, this is years ago. 23. Him and his girlfriend had come in, and he was really embarrassed because he said that he was really stressed out, and he would use this it was a Coke bottle, like the glass Coke bottles that have the lids on them, the metal lids. For whatever reason, he said that he was stressed out, and that was one of the things that he wanted to use to de-stress himself. And so fair warning to people who are playing with things in their bum, your butthole is like a sphincter, and it sucks things up sometimes. So just make sure the base is broader than your butthole.
Right. What did they say? It has to have a phalanged end or something like that.
Yes. Yeah. So anyway, he had gotten this Coke bottle stuck up his rectum, and poor guy, he had tried to get it out, and so we took him into one of our assessment rooms, and we got him up with his legs up on the stirrups for when we do the gynecology exams on the women, and we tried to get him to push it out. We tried to pull it out. We weren't able to get it, and they have this thing in the maternity ward called, like, it's a vacuum delivery forceps, and so it's like a suction cup almost, and it attaches itself to something, and you can pull the baby out. It helps to guide the baby out a little bit more when people are having trouble. And so we ended up calling for that from the maternity ward and tried to get it out with that, and even that was no go.
Oh, Jesus.
So we ended up sending this young guy up to the operating room, because this thing, like, you have to remember, this Coke bottle still had the metal lid on top of it, so we have to be careful pulling it because it could tear him on the way out.
Right.
And And so
why did he do
he
it with the
ended up
lid on? I mean, what's like? Just think about it a little bit. Just, I guess
no.
there's no explanation.
No, exactly.
It's like,
So he
oh,
went to the
this seems like a good
operating
idea.
room.
I'm going to give it a try.
I slipped and fell in the shower.
Yeah.
On a Coke bottle. So
Right.
he ended up going to the operating room, and they gave him some medication called propofol, and that helped to relax him enough that they didn't actually have to do surgery on him. They were able to just pull
Right.
it out. So he's really lucky that he didn't end up doing any damage to his colon, because that, I mean, depending on how
Yeah.
bad it is, sometimes it's irreparable.
Right, and also because it's like non-sterile, and then you're, infecting the areas
Yes,
around, and you
well,
can cause
yeah.
yourself a lot of problems.
Oh, yes.
I mean,
right.
it always amazes me. It doesn't, listen, I'll be honest, it doesn't amaze me that people do those kinds of things, but it amazes me the, like, sort of almost lack of foresight about it, where you're just, in my head, I'm like, well, just plan a little bit. Just be like, well, what happens if this doesn't go as I thought? Like, how well can I, like recourse my actions based on what's happening, so that I don't have to go to hospital? But
Right.
I guess my brain just works a bit differently. And
Well,
also,
and that's what makes us all
I've
unique.
heard, yeah, exactly. And I've heard of people put crazy stuff up there, like child toys and bottles, you said, and it's just, you're just like, what are you doing? Just, be an
Yeah.
adult, go get something that was made for that purpose. If you're interested in
Hamsters,
that kind
even.
of stuff,
Like
oh my God, there are stories like
yes.
that, like gerbils and shit.
Yes. Oh.
Now, is that true? Have you seen one of those?
I have not, but that has happened to someone that I know as a nurse, like on shift. They had a patient who would come in with a hamster in their rectum.
Now, was it alive? Surely not.
Oh,
I mean,
yeah, it was.
I mean, I imagine
Yeah.
it was when it went in, I guess. But now, now, logistically speaking, that just doesn't seem like it's possible. Because, shame, poor hamster, right? Like,
Right.
if anyone's the victim in the situation, it's the poor hamster who's being
Yes.
shoved up somewhere. And none of it makes sense to me. Because I'm like, what's the best case scenario here? That, it's
Their colon gets
so
tickled.
bizarre.
I don't know. It is very strange behavior. It's something that I too don't understand. I think
Also,
you should
what happens
probably
if
maybe
it goes burrowing?
well, and that was part of the problem that was happening with this
Yeah.
person, is that it was like the hamster started to freak out, and it started trying to
no
scratch
doubt.
its way out of the colon. So I don't know the outcome of that person, but nor the hamster, but I would imagine that the hamster probably died at some point.
Yeah, suffocation, unfortunately. But,
Yeah.
that's what would happen if you get stuck up there. No air to breathe. Yeah, and then,
No.
oh my God, it's so much worse because they're going to be in this, the hamster's going to be in this like frantic state of survival, being like, I need to get out, and just trying to
Yeah.
like dig and move and just cause like wreckages and chaos. It's just so unnecessary, in my opinion.
No, I
I mean, in their
absolutely
opinion,
agree.
they were like, no, this sounds like a good idea. Now, there seems to be a lot of men who this happens to. Why do you think
Yes.
why? Like,
Ooh.
is it something, I mean, I don't know if you have an answer to this question, but it's like, is there some
I don't
filter
have an
that just
answer.
doesn't work?
I don't, but I feel that in some ways there's like this fetishization to that. And I think that if, probably one of the best people to answer that would be actually Dr. Deborah So. I'm not sure if you know who she is, but
Yeah.
she's a sexologist, and she studied a lot of this fetish behavior. And so, like the paraphernalia
It is very
type
curious.
stuff. And it is very curious. And so I'm really not too sure, but I think that she would probably have an answer.
Yeah. Yeah, it is certainly, I mean, there are answers, and whether they're helpful in explaining what the reasoning is, questionable. You're like, I mean, I suppose that makes sense, but it's still pretty crazy to do what
Yeah.
you're doing, And like, you
Yeah,
can be
no,
like,
that-
oh, it
that
was
would-
because of this childhood trauma or something happened here, or like this is when you got into it or something, and you're like, okay, yeah, that kind of explains it, but it doesn't really help the situation, because what you have done is just, I mean, how could anyone do this kind of thing?
Oh,
But
yeah.
people do
Well,
all the time. and they don't
There's a
learn
lot of
either.
bizarre stuff. Yeah, there's a lot of bizarre stuff that comes in. I mean, we've had people who have gotten high on LSD and have tried to fornicate vehicles, have tried to have sex with like Tide bottles. We had one guy, he had to have, oh my gosh, what is it called? An escherotomy, I believe, when they have to cut down like the side of the skin because it's swollen so much. And his penis had
What do you
gotten
mean?
so
Oh,
irritated and raw,
I
and
didn't
it
know what you were
swelled
talking
so
about.
much. No, and so it swelled much more than it is supposed to, and
Yeah.
and because of that, he actually was risking losing his penis because it was so swollen. It's called compartment syndrome, and so they had to cut his skin in order for the fluid to leak out so that he could have his penis saved. And then actually, oh God, speaking of that, I just remembered we had,
Yeah.
oh wow, we had a patient in the old hospital I worked at who, he was a mental health patient and we didn't have a spot for him to go to. And so he ended up going to the washroom and cutting his penis off and walking up to the
Oh my
triage,
God.
and then at that point, well, it became a totally different type of call. So he had to come right in. But some people will go to extreme lengths to, and I mean, you have to remember this person also is a
Sure.
psych patient. There's some serious mental health concerns with that person. But yeah, to like some people will go to some extremes just to get medical attention.
God, what did he use to cut it off? Like a razor blade or something? Like, what do you find in a hospital bathroom? I mean,
Well,
unless he
not
brought it with
nothing.
him. I don't know.
Yeah, well, small town pocket knife.
Yes. Okay.
Yeah.
Handy. You know?
Oh.
Handy for when you need it. Just, that's what you carry it around for. I mean, in case of emergencies, you know? In case you just want to castrate yourself, you're just, why not?
Oh my
Just,
gosh. Yeah.
isn't that super dangerous though? Like, you can die, right?
Oh,
Like
you
if
could
you-
hemorrhage. Yeah.
Yeah.
Absolutely. Well, if you
Because
think
there's
about it, there's a
definitely
lot of
like
vasculature.
serious blood flow. Yeah.
Yeah, there's a lot of vasculature in that area, like your whole abdomen down, right? So there's definitely a major risk of hemorrhage.
That's crazy. You know, the medical field is like it's very interesting, but some parts of it which, you know, I guess people who aren't in the field don't really know or think about, right? Like when I was in high school, like we had to do like a job placement thing, and I job shadowed an anesthetist or an anesthesiologist, like they might call it in this country. And so I went and watched a whole bunch of surgeries of all kinds, right? And it was really cool. I mean, I ultimately was like, this, I don't want to do this, but it was a great experience. And like the tools that are used in surgeries, you're like, this is a hardware tool. This is like an electric saw that you're using to cut through bone. Like it's so violent. Like not in
It
a,
is.
I don't mean to say that in like a disrespectful way. Like that's how the surgery works, right? And they do fix things and it goes really well. So it's not like it's a bad thing. But when you're seeing it, you're like, what? You're like, how is this okay? I mean, one that stands out in my memory is I watched some kind of brain surgery that I don't remember exactly what they were doing. But basically they had this guy and they like cut along his forehead, an incision like along his forehead, and then basically just peeled off the skin. And I was like, oh, I didn't know skin does that. You can just rip off someone's face basically. And that wasn't even the worst part. What happened was then they needed to cut through the skull, right? So they drill 3 holes in like a triangle with a drill, and then they use like a tiny little electric saw to like cut a triangle out of this guy's skull. And then they just took the piece out and then they just like put it somewhere. And then you could see inside and they could access the brain. And I don't exactly remember what they were doing, but I think they were like relieving
Pressure,
pressure,
intracranial pressure.
something
Yeah.
like that. Yeah, it was something along those lines. And then when they were done, they kind of just put it back and like stapled it in place or something like that. And then they sewed everything back up. And I was just like, this is, I mean, what is going on? You know, like that was hardcore. Or like another surgery I saw was this guy was having a leg operation. He must have broken his like, what's the big bone in your leg?
Femur.
Yeah, your
The
femur,
femur.
which is like a serious bone, right? And I guess they were trying to like pin something through it, from what I remember, or take it out. Actually, they was the part that I remember. It wasn't the putting in. So I don't know if they had to re-put it in or what was going on. But they had this metal pin in this guy's leg. And how they were taking it out was the end of the pin had some sort of like a flat head, at least at the time. And the surgeon took a hammer and was just like hammering at this thing to like get it out of the leg. And I was like, this is so crazy. Like, how is this just what surgery is? Right? Never mind like that it works perfectly and that the body miraculously deals with it and heals and, in many cases can recover back to somewhat normal. But the surgeries they're so violent a lot of the time. And it's just it's an amazing thing to see, but also it's quite, like jarring to witness.
They have to use so much force in order for them to be able to remove bones or to be able to get through things. Especially I went from emerge to a cardiac surgery intensive care unit, which is all open heart surgery. And for some patients, we will do minimally invasive procedures, meaning that they actually don't cut through the sternum. But the risk is that if there's any sort of complication or bleed afterward, they have to cut through your chest. And so we got a big saw, and we have to sometimes cut through in an emergency.
Yeah.
It's but it would be the same saw tool that they would use in the operating room to open up their chest. And it's quite interesting to see. But, if you're not used to those types of procedures, you would be totally aghast at how much force has to be used in order to open things up and separate things. Like they have to put these big clamps on to hold people's chest open.
Yes.
And a lot of people will complain
They like wind it open.
Oh, my shoulders are really sore. Well, it's because you were stretched right open,
Oh my God, it's so crazy.
And the body's just, it's so beautiful in how it actually repairs and heals itself after all that.
I know. It's unbelievable. And I mean, thank God you're not awake when surgery's happening to you, because you would be like, fuck this. Like, I see a saw that looks like you're going to cut down a tree and you want to use that on my chest? No, thank you.
Yeah.
Like that is not happening. I mean, it looks like one of those power tools. I mean, which it is. It's just
it is.
I guess a special one for surgery. It's not from Home Depot or whatever.
You don't want to get any sawdust in those incisions.
Yeah. Or like another memory just came to mind of I saw a C-section delivery, and like the force that they were using to like basically like open up this woman's stomach or I don't know, abdomen area and to like make a hole so that they can take the baby out. I was like, you're going to kill her. Just like, I mean, I didn't say that, but in my head, I was like, she's dying. Like that must be what's happening. And obviously she didn't, and it was fine. And there was no problems. And then afterwards I was like, oh, I guess they're kind of all like this, which is so crazy. And then when you worked now I just thought about how, because then you transitioned into like paramedicine, and so you worked as a paramedic for a long time, and then you must have seen some like, or lots, I don't know, of incidents where you're basically coming up to a person who's open in some regard. Something's hanging out, or something's hanging off, or a bone's like protruding through, and you just got it. And then, well, I mean, you that's what you're there for, is to like triage and deal with it, obviously. But it's really must be a shocking thing to see if you're not used to it, right?
Yeah. Well, so to be completely frank and clear, my experience in paramedicine was not on the trucks. So I actually worked kind of with the certification body through the base hospital, which would oversee the different levels of care of paramedics in the flight system. I worked in the flight system, but the experience that I had going through my preceptorship and also in the emergency department really was something that solidified a lot of those things. And we did, obviously work synonymously with them as they brought their patients in. Yeah. So I full stop, wasn't on the trucks, but definitely still worked for, I still work within the field. I just don't work on the truck.
Sure. And those patients, regardless, are still coming right into the ER where you are, right?
Yep.
So you're not missing out on the action.
No,
It's just
no, it's
you're just
actually
one step inside.
which is in many ways better for some things, because we're in a more controlled environment. We have more resources, we have more tools, whereas paramedics who are on the front lines are very limited sometimes to the resources that they have available within the region.
Sure.
Even depending sometimes on the level of care or experience of their partner. Is it a new partnership? Do they work well together? What kind of situation are you going into? There's a lot of variability in how predictable things can be. So there's, major safety considerations and, highways, buildings, your natural disasters. There's all sorts of different things that they're responding to that, bring a lot of risk.
Yeah, and also just dealing with the people when you get there, right? Like,
Yes.
it's one thing where you're like, oh, okay, I got to deal with the safety concerns for myself and my partner and, figure out that situation, while at the same time being like, well, I need to save this person or, do whatever needs to be done. And then there's also another element of like, well, who is this person? Are they going to be receptive to us? Like, do they want help? Are they on, some like heavy drugs that are going to be so erratic that their behavior is going to threaten our safety, or mentally ill or something like that, which I'm sure happens all the time. It's so much to manage. And then at least, where your role comes in, like in the hospital, like that part's kind of been dealt with and now they're ready for treatment, although I imagine they still sometimes put up a fight, right?
Oh, yes. Yeah. Especially the ones who are on opioids. When you start to provide them with naloxone, you have to be really mindful as to how fast and how much you're providing to them. Because what we want to do with that is just to make sure that they are able to take a good breath. Like, we don't want to be trying to completely reverse it, because you have to think about each individual situation. And
Right.
the individual themselves may be a long-term user because of some sort of like medical problem, and now
Sure.
they've become an addict and now they're using a lot. So when you take that away from them, they're not only confused, but they're also in a ton of agony because you've just reversed that narcotic effect. So a lot of
Right.
times what we will do, it depends on the patient, is we will actually put a soft restraint on their wrists, because we don't want them to wake up and start like thrashing out, because
Yeah.
they could potentially injure people, right? But I
Yeah.
wanted to go back to, the comment you made about, managing things on scene and there being a
Sure.
lot of people, because that can sometimes be a safety concern in and of itself. I actually, so interestingly enough, a couple years ago, I had I just gone to go get some salad. My husband asked me to go grab some salad, so I went to go grab some salad for dinner. And so I just where I was, I happened to be right near a Shoppers Drug Mart. And this particular one had some of the produce in it. So I went in, grabbed a bag, walked out, and as soon as I looked over to my left hand side, I could see somebody lying on the road and a bunch of people standing around them. And of course, I'm like, oh, for fuck's sakes, right? Oh no!
Like I got to deal with
'Cause
this
I
now.
gotta do this, right? So I was on the
Yeah.
phone with somebody, so I let them go and I went over. And this is a major intersection. So this is Huron, Ontario, and Eglinton and Mississauga. So we're talking, like 6 lanes wide on,
Yeah.
both sides. And what had happened was this gentleman who, it was nighttime, he jaywalked. He jaywalked into oncoming traffic, and the poor girl who had hit him didn't see him until it was too late. So she had
Yeah.
hit him, and he actually, I'm really glad that I didn't see the impact, because he was thrown about 50 feet. And he was
Jesus.
probably about 6'4", like really tall, about 350 pounds. Like, he was a tall and big gentleman. And so I run over there, and nobody was really doing anything but standing there. They hadn't called for an ambulance at this time. So of course I'm doing my assessment on this gentleman, and he's not responding to me, and I check his pulse, and sure enough, he's in cardiac arrest. So now of course, like, this shit's coming, it's becoming real. It's happening in the middle of this big intersection. I've got traffic zooming by, you know, so of course I had to start delegating roles. I'm doing CPR. I'm delegating roles to all these people. And, you know, someone's like, I'm a first responder. Someone's, I'm a volunteer firefighter. So I was able to get people to help, right? Because this is what you got to do.
Yeah.
You got to use whatever resources are around you to try to, you know, check traffic, make sure that, you know, it's safe, that there's, you know, a barricade at least around and a point of entrance for the ambulance and the other first responders to be able to come. And so anyways, I'm doing all this stuff, and this is where it kind of gets a little bit weird, because I also am a medical director for a couple of marathons in the GTA, and so I just happened to have an AED in the back of my car, and I would never normally have one of those in my car. And so I got someone to, you know, take over compressions for me while I went to go get the AED, and ended up bringing it out and using it and, you know, running the resuscitation. And then the paramedics came and we loaded him up into the back of the truck, and we, you know, ran through everything, and then they went to the hospital. And, but, you know, to, like, those people that were there, had they not been there, had this been, you know, out in the middle of nowhere, I would have been feeling pretty helpless at that time. But because I had other people there, I was able to assign people tasks and be able to, you know, do what was best for that person at the time until the appropriate level of care was able to get on scene and transport him to the hospital.
Yeah, that's crazy. And also, like, you do have to take control, right? If you know what you're doing, and you can, because people just, they're in shock, and they're like, well, most people are like, I don't know what to do. Like, maybe I'm going to make it worse. Like, I don't want to, you know, like, well, and it's what's it called? Is it the bystander effect? Where
The bystander effect, because someone thinks
yeah.
that somebody else knows better or is going to do something about it, so they don't do anything. Or
Yeah,
they don't feel
everyone's like,
confident in
someone
their own-
else will do it. Yeah.
Yeah.
It's a really big problem. It's a
And then
human
that was one of the
problem,
things
but
that was happening.
yeah.
Yeah, that was exactly what was happening when I first walked out of the Shoppers Drug Mart, is that everybody was standing there not knowing what to do. Because, I mean, I had missed what had happened just prior to that moment with the gentleman being hit, so I didn't get to see that. But, excuse me, I'm sure that the people who were there that witnessed it, like, it would have been so traumatic for them, right? And that poor woman, I feel so bad for her. I still think about her sometimes, because I'd like to know, like, how she's doing with everything, because, like, that was an accident, and this gentleman, he died. Like, usually when there's some sort of, you know, major traumatic injury such as that, and they're dead in a pulseless electrical activity, on the monitor, because I actually had a monitor on my screen that showed what cardiac rhythm he was in, they typically don't survive. It's like pretty much zero chance of survival. So I think about her often, and how, you know, she's been managing and coping, because I remember coming out of the back of the ambulance and seeing her as patient number 2 now. Because
for sure.
the adrenaline had worn off of her, that was keeping her calm. And now that this gentleman was in the ambulance and on his way to the hospital, she just went into shock and just was laying on the ground and couldn't, like, she was shaking. I thought she was having a seizure at first. But it was just all that excess adrenaline that was in her system.
It's almost impossible to imagine unless you've been there, right? Where you're just driving home, and all of a sudden, you know, someone just jumps out of nowhere. You can't see them. There's nothing you can do about it. And then you hit them with your, you know, car, which weighs like a fortune. It doesn't matter who the person is. It's just like, goodbye, Charlie, you know?
Pounds. Yeah, exactly. Yeah.
Yeah. I mean, and there's nothing you can do about it either. It's happened and it's done. And there's no going back, right? It definitely would be, I imagine, hard to deal with. I mean, yeah, I guess some people would deal with it differently, right? Like, depending on what they thought of their role in the situation versus, you know, because I mean, just speculating, I would think that some people could, like, psychologically work their way around it by, like, blaming the other person and being like, it was their fault, not, I didn't do anything, which in some sense is true, but it doesn't absolve responsibility totally, because it was still you in the car, and your action or inaction, like, in some way led to this being a problem. I mean, I say a problem, like a death. And so
Yeah.
I'm sure it's terrible to deal with.
Oh yeah.
Like that.
Yeah. And that's why I think, because I have my own experience with mental health challenges or traumatic stress injury from working within the emergency department, I actually have a lot of compassion for people in instances like this, because her whole life has changed. This man's life and his whole like all their families and friends, like their lives have changed forever. And so, to recount that, like I only hope that woman was able to get appropriate psychological services, and that she had a really good recovery environment within her home and amongst friends, so that she could actually work through that and not be left with lasting damage.
Yeah, I hope so. I mean, it does. It can cause a real upset in your world. And the crazy part about it is that, like, these things happen sort of all the time with enough people in the world, right? And you don't think about it until it happens to you, or if you're, a big news consumer, I suppose you might see all the tragedies and things like that. I tend to avoid that as much as possible. I'm like, I don't need this in my consciousness, Like, not that I pretend it doesn't exist, but I'm like, I don't want to spend 6 hours of my day just reading about the tragedy in the world and not being able to do anything about it, not knowing what's even possible to do about it, and in many cases completely unable to do anything about it, particularly for accidents, right? Like, you can take safety precautions, and you should, and there's only so much you can do, because we are,
well, that's
to a large degree fragile.
Truthfully, there are no accidents, right? Like so
sure.
in this situation, this person made a decision to step in front of traffic, and that led to his unfortunate demise, and this young lady's living with those, well, everybody's living with the consequences of that decision of his, right?
Yeah. No, for sure, you're right. The accidents is like a complicated word, because it is decision making a lot of the time. I guess it's more of an accident if, like, you're walking and a boulder falls and hits you and kills you, and there was just nothing that could happen. I mean, you kind of you're somewhat responsible for your actions. You're like, oh, I chose to walk this path today, but it's hard to blame people for that.
Yeah, well, no, and I mean, really, at the end of the day, like, the last thing we want to do is be placing blame on anybody. It's just a really unfortunate type of circumstance. Yeah, you walked down that path. That boulder, I guess it was just, for some people, it's just the way it is, right? It just happens.
Yeah. I mean, one of my favorite road signs is the sign of, like, falling rocks, like when you're driving on mountains or things like that. And really, it's such a ridiculous sign. I mean, I know why it's there, because they're being like, well, watch out. But for the most part, what they're saying is be lucky, right? They're like, this shit might happen down this road. So if you're choosing to go down here, pray or something like that, because your car's going to be crushed, or it could be. And then, people will be like, well, there was a sign. It told you that was going to happen. So, I mean, I don't know.
Yeah.
It's hard, hey? And we live in a really strange, like, being a human's very strange. Like, I spoke to someone on the podcast the other day who was, like, diagnosed with, like, early onset Parkinson's. And so he's had to deal with that. And I'm speaking to someone coming up soon who has had cancer and has it, like, recurring every year or whatever, and then he's now become, like, a therapist to help people with it. And he deals a lot with people dying, just like anyone in the medical profession. And it's like, for most people, the concept of death, you kind of know that it's there, you just don't really want to think about it for the most part, particularly your own death, because it's just like, it's almost incomprehensible to even imagine what happens, right? And it's scary for sure. And yet it's such a real part of life, right? And it's a part of everything. I think that we don't talk about
it enough. Yeah, well, it is part of the life cycle, and it's going through my own experience recently with losing my mom, that was really hard for me, because it made me question a lot of things, like, where do we go? Like, why do we go there? Why do we die? Like, it was a very sudden death. It was unexpected, and so for me, that I think that was probably the most difficult part of it, was that, I was just having a conversation with her like the day before and a few days earlier, and yet here we are, and that person is no longer present. And so I think that we tend to focus a lot on what is objectively seen, and not so much on the subjective aspects of things. And so we really, well, because this is our human experience, is to be with and amongst one another. And so when those elements change and those people are no longer there, it really starts to make you question, everything about life, and what is the purpose of death, And so, that's a whole other conversation, but
sure.
It is definitely something that is intriguing. And I think that it should be normalized. It is part of what we experience as human beings. And so many people are so scared of or don't even think about it and prepare themselves for
and they don't think about it because they're scared, right?
Right? Yeah.
And understandably, not irrationally so. Like, your existence is coming to an end as you know it.
Yeah. Yeah.
Perhaps something else happens afterwards, but who you think you are at the moment, that's temporary, right? And we live in a really, like, in Western cultures particularly, I suppose, is all I can speak to, is death is very much hidden from us as much as possible, right? Even like people who are like aging, like, we kind of, there's a very much a sense of like, just kind of put them over there. We don't want to see it because it reminds us of our own mortality. And, the whole like burial process and things like that, it's not always, but it's often very like secretive, and it's like, it's, you can't like see dead bodies, like there's like laws against those kinds of things. And it's like, well, I mean, if you go to just like any third world country, you'll see dead bodies everywhere. Not everywhere, but a lot, because they got to deal with it themselves, right? And so for them, death is like it's just viewed differently. And I think it's definitely brings perspective into your life when you are confronted with death. And whether it's, I mean, usually it's more serious when it's your own, but most people will experience other people's deaths more than their own, because you only get one of your own. But
a lot of people most people only die once. There's a few people that die a few times, and because
That's
of
true.
the grace of because the grace of their circumstances, who was there, how it happened, medicine, it certainly can provide life for other people, for some people. Again,
and near-death experiences. Yeah, near-death experiences are always so fascinating to me, right? Or we say near-death, but a lot of the times it's like, well, actually you did die, technically speaking, and then you were resuscitated, and so then you were alive again. And, I guess your brain and your experience doesn't exactly switch off for a while, and so people come back or get resuscitated with memories and ideas of like what happened and how it transformed their view of living again. Not always, but oftentimes it like shocks the system, right?
Well, someone that I knew from when I was a teenager, she just recently had a cardiac arrest. So her and I are around the same age, and she ended up, she was dead for a period of time, and they were able to resuscitate her, and they diagnosed her with an arrhythmia. She had long QT syndrome, which was something that she never even knew that she had. And so, again, circumstantial. She just happened to be, I hate to use this because it kind of sounds cliche, but right place, right time, and thankfully got the care that she needed, and she's still alive today, and her whole outlook on life is completely changed.
Yeah,
I
for the
haven't
better,
yet
I'm
had
sure.
the chance. But I haven't yet had the chance to have a discussion with her, to ask her about her experience, because this was just within the last couple of weeks. So I don't want to be like, hey, what was it like to die? Not exactly the most appropriate conversation.
Be like, I'll let you recover for a bit. Take some time.
But Yeah, exactly. But I find though that people who have gone through that really, really tend to lean more toward the spiritual side of things, and really like there's something that happens to them that they see or they
Mm-hmm.
experience that doesn't necessarily make them believe in God, but definitely instill some sense of
Sorry.
like otherly world around them that we're just
Yes.
not consciously aware of right now.
Yes, and it certainly puts into perspective what's important in this world and experience, right? Where even people who get diagnosed with like a terminal illness or something, a lot now, not always, because sometimes people will fight it and suffer until they die, unfortunately, but other people, that will be the impetus for a transformation of consciousness in the sense of like, oh, I get to see what's important to me, what's meaningful to me, what's part of my existence that's important. All of these small problems that we spend so much time thinking and worrying about. It's like that shit doesn't matter, right? It matters relatively speaking. I mean, it does matter, but in 1,000 years, it doesn't matter. And then
Yeah,
you
exactly.
you just go like one step up and you're like, oh, doesn't matter. Like, little conflicts and little, even big conflicts are relatively speaking, not what's the most important thing, you know? I mean, like, I know this is a bit of a random thought about it, but I was thinking about how, like, if aliens were to, like, view Earth, right, just from a perspective of, like, humanity, and we sort of we view other animals in that kind of light, where you're like, oh, there's like a colony of ants, let's say, and there's two colonies and they're fighting each other, right? And they're killing each other over territory and food and whatever is important and resources and whatever. And for us, we're like, oh, I mean, that's how it is, and it's I don't want to get involved for the most part. And yet, from the ant's perspective, like each ant has a whole life of difficulty and hardship and like finding food and finding shelter and dealing with the weather and dealing with predators and dealing with humans stepping on them. And there's like a whole world of challenge and difficulty that is important for each individual ant and the collective at the same time. And yet you go one step or two steps higher and it's like, oh, they're just ants doing ant shit, you know?
Well, yeah, yeah. Well, it's all these like little micro communities,
Yeah,
surrounded by other
exactly.
micro communities, surrounded by macro communities. And it's
Yeah,
interesting because they don't have
100%.
the same consciousness as we do. Like they
Right,
can't
of
think
course.
about this in the same way, so it's all usually driven by different scents, like pheromones almost. And I don't know what ants have.
Yeah, something like that.
But they're definitely they do follow scent, and it's very much it's a lot of order. I find it to be very, very orderly within those
Yeah,
different types of communities. But then I also, I'll be mowing the lawn, and here I am mowing the lawn, and I'm thinking to myself, can the ants, like, what do they feel? Do they hear
yeah,
this? Do they have ears to be able to hear the sound, or do they just feel the vibrations? And does me mowing the lawn or walking over top of where their colony is, does that put them into a panic mode, or are they used to, like,
yeah,
I consciously think about this stuff, but I'm like, the
yeah,
ants don't give a shit about me.
yeah. Well, I mean, 100%. I mean, that reminded me of like I was doing some gardening, and when you do planting and stuff, I find a lot of worms. And I don't like to kill them, so I just kind of pick them up and like chuck them into a place where I'm not busy, so they can get back to whatever it is they were
Yeah.
doing, the worm. And then I thought about it, and I'm like, what a crazy experience for this worm, where it was like doing its own thing, and then all of a sudden it's unearthed, right? Brought to the surface, just put in the sunlight, and then this giant creature just like picks it up, like looks at it, and then goes, and then just like chucks it somewhere else. And then it has to be like, and then goes about its business again. And it would just like a mind blowing experience if that had to happen to us, right?
Oh yeah.
Like that, and like people who have had like experiences with alien abductions, like if we give them the benefit of the doubt and say that it happened to them, it's some sort of similar thing where you just get sucked up and then looked at and evaluated and then just put back somewhere. And then they're like, all right, figure it out yourself now, you know? And yet for them, it was like this, just another world has happened.
Yeah.
Exactly, yeah.
Yeah.
Nature is really cool. It's like, as you say, it's order and yet it's chaos, right? Like evolution is pretty chaotic, and like requires a lot of struggle and challenge and things like that.
Absolutely.
It's always fascinated me, those kinds of things. Now, how did we get onto this subject? I can't exactly remember.
We started talking about death. First,
yes,
I think we started talking about, you know, teams and resuscitation, or not resuscitation, but working with people in you know, safety considerations for paramedics and stuff. But yeah, no, the death part of it is kind of what triggered this aspect of consciousness, and whether or not, you know, people really experience what they experience. So it's interesting.
What happens when you die?
Exactly. Well, what's interesting is when we do certain types of surgeries, we'll do what is called circulatory arrest. And this is usually for major surgeries where they have to basically, you know, repair from the heart all the way down to the kidneys, like part of the aorta, right?
Okay.
And so the circulatory arrest process involves the person being hooked up to a cardiopulmonary bypass machine. So they put all these hoses and stuff into the heart and the lungs, and basically what they're doing is they're simulating the heart and lungs. So they're working, this machine is acting as a heart and lung for this person, while we drain all of the blood out of the person, so they have no blood at all. And it's
Jesus.
You know, so the machine, the cardiopulmonary bypass machine, is filtering this blood and keeping it moving within itself, but the person is drained of all their blood. They get cooled down to a really cool temperature, usually around between like 13 to 18 degrees, if I remember correctly. And the surgery will proceed. It'll be hours and hours and hours that they're on the surgical table. And then once the surgery is done, then they will, and this person is clinically dead. They've got no blood, nothing. And we'll put the blood back into this person, and they'll start to warm them up and wake them.
Kickstart life again. Well, so wait, hang on a second. What are those surgeries that are being done? When are they doing this to people?
So it'd be like a Bentall procedure where they're basically, you know, it's a very, very large aneurysm that has torn its way all the way down the aorta. And so that sometimes will require surgical intervention from not only a cardiac surgeon, but a thoracic surgeon, or some really complicated surgery will require that. So it's few and far between where we're actually performing what's called a circulatory arrest on patients. But those patients, they take longer to wake up. Like, we don't wake them up as fast as we would normally wake up a patient who's had just an uncomplicated cardiac bypass surgery. Like, we'll usually wake them up about 4 hours after surgery, where this one we might we'll wait till the next day till we start lightening their sedation, because we find that they take a little bit longer to recover because their body has been through so much more.
Yeah, I mean, that makes sense. You know, you drain them of their blood and hook them up to machines. So it makes sense that their body is like, what's happening? Yeah. You know, like this is going to take a minute to recover.
A lot of them have delirium, so we call that pump head. For those patients, because they're confused and sometimes combative, and just it takes a longer time to wean them off the sedation to get them up and mobilizing.
Right. So is that like an instinctual, like, fight or flight reaction when they're sort of coming round and they're just like panicked and fighting? Yes. Yeah,
because
did they do that for like heart transplants?
So, I can't answer that question because I don't know. I would imagine that they probably would, because they'd have to cross clamp all of the major vessels to the heart. So I would assume that they would do a circulatory arrest for that, but I'm not 100% sure.
Sure.
Yeah.
But sorry, you're saying when they wake up, they're coming to.
So when they wake up, you have to remember that they're waking up because they're still on life support, right? So they have a endotracheal tube, so breathing tube. They're hooked up to a ventilator, so they're not breathing naturally. So there's this like narrow, almost like straw, that they're it's painful, right? It's painful. It's
Yeah.
unnatural. This machine is forcing air into the lungs. You're disoriented because you're on, sedation and narcotics. And you've got all these lines and tubes, and there's all these, pumps running, and it's very intimidating for the person who's waking up, because they don't know where they're waking up. There's nothing that's familiar to them. They're having side effects from the medication, and then they've got all these lines and tubes all through them. Plus, I mean, like, even in their chest, they've got mediastinal chest tubes. Some will have Swan-Ganz catheter that is, basically it's like a
in the neck.
Yeah, it goes into the neck, and then this wire, they inflate a balloon on the end of it, and it travels through the heart, and it goes into the right atrium, so that you can actually check the pressure within the heart. So yeah, it's really cool stuff. Really cool
That
stuff.
sounds
so they wake
cool.
up with all these lines and tubes, and it's so scary for them, and so yeah, like some are combative.
Yeah. Yeah, I'm sure. And I bet you they don't even remember that part a few days later. They're
No.
like, just
No.
no memories. Sedation is very helpful in that capacity, right?
Yes. Oh, yes.
They're just like, yeah, all right. Man, medicine's truly extraordinary, like what can be done these days, and how much is known, even though relatively little is still known on a broader scale of things. It's like so much already is known and can be done and can be used to help people. It's truly extraordinary,
Yeah. Yeah, it really is.
I mean, they were doing like medieval surgeries like back in the day with some success, I would say. They were trying,
Bloodletting.
but we're definitely at a different place, or like skull screwing or things like that.
Yeah.
Just a quick point, a random point. I saw a thing of, they found this skull from thousands of years ago that had basically had a piece of it had been replaced with like gold or metal or something.
Yes. Yes.
Yeah, and the bone had grown like fused. I don't know what the right word is, such that they knew that they had survived the surgery and that it had worked because there was growth that happened afterwards, right? And so it was a successful open head surgery that they managed to survive infection and all that kind of shit. And like, how did they do that? I mean, that's pretty extraordinary. In my opinion.
That was that an Egyptian case? I think I remember reading.
I think so.
Within
Yeah.
The last month. Yeah, I think it was within the last month. I read an article on that, and it is truly amazing some of the things that they were capable of doing then.
Yeah.
And that we're
some of the things
now.
some of the things that they did back then were a little bit less, amazing. And now with what we know today, you're like, okay, like you were trying. And I guess we'll look at what we do today in a similar light, in 100 or 200 years from now. They'll look back and they'll be like, those barbarians.
So hard. It's so hard to even comprehend where medicine is going to go from here.
Right, particularly with like cybernetics, like hooking up to machines, and that'll just take a new direction completely. Like, what does life mean then?
The whole robotics aspect of having the surgeon controlling the robot rather than doing the surgery directly themselves. Like, they are still doing the surgery, but they're just not directly cutting into the person. So they're doing that stuff now, right? And even with the mRNA vaccine technology that is being utilized for these COVID vaccines, I mean, that stuff has been being studied for quite a few decades. I want to say like 3 decades now. And, it's finally found its purpose in the medical world, and where that could potentially go is so exciting, because basically what they're doing is they're just putting the genetic code for different disorders into this mRNA, and it's helping to, like, they're thinking about using it for all sorts of different things, cancers, multiple sclerosis, like, you name it. And so we're in the infancy stages of it being utilized for a lot of the ailments that we understand and are experiencing. So it's going to be exciting to see where that goes in the future.
Yeah, it's extraordinary, the science that has come through. I mean, I don't know if this is mRNA related, but I saw a thing on like an HIV vaccine that was that is being developed at this point that had never been around before, and all sorts of just advancements in that field, and it's crazy. Yeah, I mean, what the craziest part to me, I mean, I know we're sort of coming to the end of our podcast, but I'll just mention the craziest part to me about like genetics is that what they figured out is the best way to do is to use the genetics that you have and just change it to fix things, as opposed to trying to add or take away or create something new. It's about adjusting how your body self-regulates and being able to like fix it that way. And I mean, I guess medicine in general, like, pharmacology in general, to some degree does that anyway, right? It's just not at the genetic level. It's more at the, I guess, molecular level or something like that. Particularly with like brain chemistry and whatever, where they're trying to rebalance things.
Yeah.
But anyway, the future holds a lot. Yeah.
It does, and it's exciting, and I'm excited to see what comes out of all this new technology.
Yeah, me too. We just need to get over this COVID bit, and then, hopefully soon. Yeah. Things are somewhat looking up,
Well, now that we have access to more vaccines, a lot of people will have had their first shot in the next couple of months at least, and so we'll see things start to open up in increments, and it's been really great to see that the science, like, nothing's really changed with the science. It's just more the understanding that how COVID as a disease works with relation to the vaccines, that now that we know that it's similar to other respiratory pathologies in that, you have a lot of immunity when you have your vaccine, this will allow us to open up our economy, allow people to get back together and have some semblance of normalcy. So I'm hopeful that by this time next year, everything will be open and we'll be able to get back to, I don't want to say status quo, because obviously it's going to be impactful to society for a few decades to come, but it'll be
that's for sure.
Some semblance of normalcy again, which will be great. I just want to I want to visit my friends. I want to hug people. That's the one thing that I really miss about this, is not being able to hug people. I'm a big hugger.
Yeah, me too. The contact deprivation's rough. But listen, you do what you got to do,
Exactly. I'm not sure what we're going to do right now, because we have this pandemic has exposed the deficiencies that we had already existing within our healthcare system, and it's actually exacerbated many of them, the opioid crisis being one of them as an example.
Yes. The addictions and mental health situation is going to, I mean, it's already taken, I don't know what the right way to phrase it is, but it's not going well. I think they released a report over around 2,100 people died from opioid overdoses between March and December of last year. So that report just came out. So that's really concerning. Really concerning. So we're dealing with a crisis within a crisis, and it's it's going to take a really long time for us to be able to find our balance with that. I mean, the opioid crisis was, mental health and addictions has been an ongoing issue that has been historically underfunded and historically misunderstood, and there's so much more that can be done to mitigate some of these issues that I just don't think that the resources, the time, the funding, there's so many variables that are influencing this that are going to continue to negatively impact those specific areas, because there's it's going to be generations before we can fix some of these situations. Yeah, definitely. I mean, not to get into it, but just think about the kids that have gone through this COVID situation. The fear that has been instilled in them, somewhat understandably, but of just other people, right? Kids have just, for the last 18 months, have been told, don't go near anyone, don't touch anyone. The world, everywhere you go is dangerous. It's not the exact narrative that people have told their kids, I'm sure, but the general message. That's what they hear. Because that's what we've all been feeling. Just adults are in a different position to know that it's kind of a temporary thing. You can revert. Or like, you know, the newborns who have been born into COVID, who have seen 5 or 10 people in their whole life, right?
Yeah.
Never
How is
been
that
in
gonna
like,
impact them in the long
yeah,
term? Yeah.
we'll have to wait 15 years to see whatever. And I'm sure it will. And the germophobia is going to, you know, skyrocket, and the anxiety and the depression. And I mean, anyway, it's,
Yeah, I
you
mean,
know,
it
as a
already has,
society,
like,
we've got a lot to deal with.
well, it certainly it's and it's going to be a shift. I've always been a big believer in, you know, being exposed to the microbes in my environment. I love to have my windows
Yeah.
in my house open. I think it's important to because we've existed with these microbes for, you know, I mean, they've been around for longer than we have, but you know,
Sure.
for hundreds of thousands of years at least, humans have been, you know, interacting with these microbes. And I find that we're actually, because we're not exposing ourselves to enough of them, I feel, and this is just my personal observation and opinion,
Sure, yeah.
that, you know, people are not building really healthy immune systems because they're sanitizing the shit out of everything, and all these things that would have been normal for us are now maybe more impactful because we haven't been exposed to them, or, you know, some of the things that we're doing are creating like resistance from these microbes, and so we can't treat them properly. So you know, you don't necessarily have to sanitize everything. It doesn't have to be clean all of the time, and you know, no germs. It
Yeah.
is healthy to expose yourself to what is out in this world. You know, if your kid
Yeah.
eats
Lick some dirt
let them
every
eat
now and then.
dirt. You
Yeah.
know, if they're picking their nose and eating it, who cares? You know.
Yeah. If you drop shit on the floor, 5-second rule. You know, that's how it
Well,
works. You
depending
eat
on
it.
where you are. Yeah, except for if
enough.
you're in the hospital, there's like, no, it's gone.
That's probably a bad idea. Yeah, hospital, like train stations, real public
Yeah,
areas. I'd
yeah.
probably be like, I mean, why risk it? You know.
Yeah, yeah.
But, yeah.
Although, you know,
Well-
like I've seen kids pick food up off of, you know, all sorts of different places, or, you know, and they've not grown extra digits, or they've not, you know, nothing has changed with them. So
Yeah,
there's
yeah,
been
yeah.
no mutations.
Yeah,
Yeah.
it's true
Well,
that like
let's-
kids get sick a lot. Hey, do kids get
Well,
sick a
yeah,
lot while
because-
they're like adjusting to developing an immune system, right?
Oh, 100%. Yeah, I mean, this is
Yeah.
why kids, oh gosh, like having a 10-year-old, not with her not being in school right now, we haven't had as many colds in the house, but
Sure, yeah.
they're little petri dishes, right? So they're exposed to everything. And it's funny because I would find that my daughter would get, you know, runny nose and maybe, you know, a fever for one day, or not even a fever, and then I would catch it and I would be like 3 weeks to recover from whatever it was that she brought home.
Shit. Yeah.
But yeah, no, yeah, the frequency of colds, or like any upper respiratory tract type infections in kids is super, super high.
Yeah. Not at the
And
moment,
they
but
spread it around.
in normal
no,
life.
not at the moment. No.
Yeah.
No, exactly.
But it'll
Exactly.
come. There'll be a nice spark of
Oh,
that when
yeah.
we get back. Yeah. Something to look
Yeah.
forward to.
Oh yeah, exactly. All the colds that we're gonna get. Well, it's funny because they went back to school here in Peel region for a period of time, and in that time that my daughter
Yeah.
went to school, I did end up getting a cold, which I was like, okay, well, here we are, we're back to normal
Yeah.
again.
This feels normal. It feels sick, but it's normal, you know.
Yeah, and yeah.
Well, listen,
It's funny. Have you
thank
had
you.
COVID? Oh, sorry.
I haven't had COVID. No. I've had a vaccine though.
Oh,
no
good.
one in
I'm
my
glad.
no one in my family has had it yet. Luckily, I guess.
Good.
But we're all vaccinated at this point.
That's good.
I wasn't like overly worried about getting it because I'm young and healthy, and I'm like, the chances of it being bad are relatively low, right? So I'm like, I take the precautions obviously, and I do what I need to do, and I've barely left the house in like 18 months, as is with everyone, right? Because that's what it is.
Yeah.
But yeah, it's the world's very strange, right? And you hear, and like, I try not take the extreme cases to be representative of what might happen to me, because I'm like, well, yeah, but I could also die in a car crash. Like, just because it happens to people, you know, the science says that it's probably not going to happen to me. And if it does, I'll deal with it then. But like to have the anxiety that some people have, you know, even in my family, like it's just like overwhelming anxiety of just of everything.
If you are
you know,
a regular consumer of mainstream media,
it's a bad idea.
I find people who are glued to the tube or through social media who are looking at different articles, they're almost instilling a fear within themselves, because fear sells. Like fear is what sells in mainstream media. And so if you're hearing this narrative all of the time and that's all you do is you listen to CNN, MSNBC, whatever station, then it's COVID and everybody's gonna die and the world is ending and oh my God, you know.
Or
and
it's
now,
just like it's just like even like even if you're not doing news, if you're just doing like Facebook or shit, and how the algorithm works of feeding you more of what you're consuming, even if you don't like what you're consuming, you are consuming that, and so it'll give you more of it, and you just see like all the worst of everything. I mean, you know, my mom will come to me and she'll say like, you know, oh, did you hear there were like two 24-year-old twins that died of COVID recently?
Oh, that's
and
horrible.
I'm like, that's really sad, but you know, firstly, it's another country. Secondly, why are you telling me this? You know, like, why are you consuming this for yourself all day, every day? Like, it's unnecessary. It makes you more anxious. It makes us more anxious because you're anxious. Like, you're doing all the right things anyway, right? You don't need to fill your consciousness with this, right?
Exactly.
Or like tracking the numbers.
Yeah.
Like, that's another one, right? It's like, what are you going to track the numbers twice or three times a day for? Like, does this really matter to you? Like, it's good to know somewhat about what's going on, but like, you're also using numbers relative to like kind of what you know, and do they really mean anything to you? Like, it's hard to even comprehend what it means. Right?
Perspective and the way that it's presented. How relevant are these numbers to, say, you know, the population of people who have been tested, or, you know, like I feel that the numbers that are provided don't paint the whole picture. And so when we actually think about this in relation to patient care, we don't treat a number, we treat the patient. And so that means that we have to look at everything to make sound decisions in our assessment to then look at what our treatment plan is going to be. And so, you know, I try to apply those same principles when I'm looking at information like that. Okay, so the numbers are, you know, 1,600 today, for example. I don't know if that's what the numbers are, but let's say that the numbers were 1,600 today. You know, what is that in relation to, like, what is the positivity rate? How many people were tested? Over what period of time were these tests done? Because the tests don't always correlate with when the test was done. So the numbers, like, there's a lag in information, so the information doesn't always jive. And then how many people are sick? How many people are recovered? How, you know, so breaking down, you have to have that context to be able to really truly understand what it is you're looking at. When all you see is a number and they're like, oh my God, there's been, you know, 3,000, 4,000 cases, people start freaking out. And then what's interesting is that they start to, you know, put blame on people for behaviors that really, this is a virus that has been around for God knows how long and has evolved around us. And this is what viruses do. Viruses mutate. Viruses, you know, regardless of human behavior, whether humans are, you know, behaving appropriately, which, what does that even mean, or not, right? So, you know, we're dealing with...
It's crazy.
We're dealing with evolution here that is outside of us. Yeah.
And people, I mean, you know, again, not to like blame or accuse people of things, but you're right, like, people tend to vilify others that are acting differently to how they think people should be acting. And in reality, they're not even really acting how they think they should be acting, right? It's like rules for thee, but not for me, or whatever it is. Yeah. And it's like, okay, settle down a second, you know? First of all, none of us really know what we're talking about, right? We all have a little bit of information on some stuff, and then it's mostly just opinion.
Well, that's
and
just
I mean,
it,
that's...
right?
and that's just how it works, right? Like even the big political moves and the big decisions that get made, I mean, you hope it's based on good information and expert recommendations, but when it comes down to it, it's like, who does the decision make? I mean, how does the decision maker feel about the situation, right? And what do they feel is the right move? And then they're going to do it, and then it will work or not work or whatever. But like, that's just how it is, right?
Exactly. So here we are, we're coming up to, the United States. A lot of people have had their second vaccination, and the CDC has just released new guidelines to say that you can do the things in most situations with no mask on if you have both your vaccines. So then, of course, you see the uproar of people that are like, well, I can't trust it. How do I know they're not an anti-vaxxer? And how do I know this? And how can they prove to me? Well, how about you just mind your own business and go about your own day? If you want to wear a mask, wear a mask. If you feel better, like, I'm not going to tell you what to do with your life. Don't tell other people what to do with their life. We have to, at some point, be able to trust one another, to be able to move forward as a society with each other. And I feel that with, all this coverage on the mainstream media, it's vilified people against one another. And it's like these, here's our camp, here's your camp, and it's us versus them kind of mentality. And it's, it gets really frustrating to see the different arguments that happen. This is why I try to stay off of the news, because the different arguments that are happening.
Well, I mean,
just even with that, you hear people say, "Well, I'm not going to take my mask off." Somebody might think that I'm a conservative. Well, what?
Yeah.
Who cares?
Who gives a shit? It's not really, a political issue.
It is not a political issue, but it's been turned into this political issue, and that in some places, I shouldn't say not everybody thinks that, but there is a lot of people that have really politicized this, and it's like, no, just like have trust in your fellow human.
Yeah, and also this is how life is. Like before COVID, guess what? The people walking around you in the street and you were touching handrails and doing all that shit, like some of those people had seriously deadly illnesses that you could catch.
Oh yeah.
That's just how it works. Way
more deadly than COVID, right? Yeah, way more deadly than COVID. Not to minimize how COVID has affected some people, because it is been tragic for some people and debilitating, absolutely. But you're 100% right that we've been exposed to a lot of other things that could be more harmful.
And also, I think that the narrative of the sort of media narrative that has dominated is that if you get COVID, at least for the beginning part, there was the sense, and I think that part of it was because it was unknown what would happen, how bad it was, and whatever it was, and there were a lot of people who were dying, which is terrible, right? Like I'm not making light of that, but it kind of instilled this fear in people of like, well, if you get COVID, it's serious and you're going to be seriously ill and die, which might happen, but probably won't happen to most people. Now, those who are immunocompromised and who have, various situations, okay, that's different, right? But that's not most of the population. So if you're not in that group, then you getting COVID is probably going to be relatively mild, right? And you've probably going to have had worse illnesses. Now, like I know some people who, like some family friends who have gotten COVID, who are in their like 50s or something like that, and it was fucking rough for them, right? Like I'm not saying it doesn't happen. But I also know 10 or 20 times people who have gotten COVID and have felt little to nothing, who are in the similar same age group, right? And it's like, okay, but you can be terrified, and it makes sense why you would be, but life is like that. Life is dangerous, unfortunately, right? And you don't know when walking past someone, you're going to contract like norovirus or some shit like that, which you could. I mean, just shit happens, or you might get the flu, which leads to pneumonia, and people die from that all the time. It's not the same as COVID, but like that does also happen, right? And it's like we used to live in a world where you accept the risk of going out in the world because you had to. Well, I mean, some people didn't, and they were recluse and sure, It's not a general statement about everyone, but
Yeah.
for the most part, you live your life and you deal with the challenges that come as they come, and you trust the medical field to be able to help you when needed, which they can do, right? And
Yeah.
there's also this weird sense of like, if you get COVID, there's nothing that can be done, which is also not true. Like there's so many medications and things like that that people will take and be given that'll help and alleviate symptoms. And maybe it's not curative, but viruses don't get cured at the moment by modern medicine. They get treated, right?
That's exactly
And so
it.
you treat the symptoms and you manage it as best you can. And overwhelmingly, the majority of the time, it gets better, right? And so it is a perspective thing. But you know, saying these kinds of things, it also kind of feels like you're saying something wrong, which is really weird.
Yeah, no,
right?
yeah, it's so controversial to talk about the realities of it, right? But it's really not.
Yeah, no, it's not. Scientifically speaking, it's not controversial, but in the current like sphere of the social sphere, like it's very weird. And I think it's because emotions run high, right?
Yeah. Well, I think that people, because this so much, fear has been instilled, that people are not actually thinking with their logical brain, right? They're not using their prefrontal cortex to kind of break everything down in a way that's actually perceived properly. And so you're right, they're running off of emotion and fear, and it's driven from a totally different place. And so you can hardly even have dialogue with people because they just get so like, and to talk about some of the realities, that we're speaking of right here, which are, again, should not be controversial. Some people find that to be so controversial because maybe the experience for somebody that they know was completely horrible and terrible, and that's the only frame of reference that they have, in addition to what the media machine has been feeding them. So you're right. The climate amongst people, I mean, it will change. It will change over time. It's got to go through its own period of adjustment, but it's really, really difficult to have honest and open dialogue about some aspects of this because people just they're not ready for it.
Yeah, exactly. And there's also like a big hesitation to even bring it up with people because you're like, well, what do they think? Like what if they're super scared and then I'm trying to suggest that we have an outdoor coffee or something like that, and what happens then? Like I don't want to pressure people into it, and then you can get so lost in the anxiety of all of it.
Exactly. Exactly. And you know what, just my advice, just ask the person, hey, I'm not sure what your feelings are about getting together for a coffee, but I'd like to see ya, and we can socially distance if you like, wear masks if you like whatever you're comfortable with, and then that way you premise it, and then they can say yes or no.
Exactly, right? And then that's the best you can do, and that's how you should relate to people anyway. Is you figure out 100%. What works for both of you, and if it can't work, okay, that shit happens too. It's not so serious. So
then we do this. We get online and we have a discussion over video chat because this is what's acceptable and good now. It'll be interesting to see what ends up happening as the economy starts to reopen some more. How the job market is going to be, not only from, I guess, the perspective of, is there going to be a lot of places that are going to be flexible with people working from home because we've had to adjust, and how is this going to impact business moving forward, and how people conduct their business with their teams. So it'll be interesting to see how that all works out.
Definitely. And what happens if people on your team don't want to get vaccinated? How do you deal with that? I mean, I know it's a whole discussion, but it's like, that's going to happen. Exactly. And they're either going to lie to you about it if you're going to be all fussy, or you can accept it, or it's very complicated,
Yeah.
I don't know what the right answer is, and I don't have any answers.
Yeah, exactly. Exactly. For me, if you want to get vaccinated, get vaccinated. If you don't want to get vaccinated, don't get vaccinated. People have autonomy, there's bodily autonomy, and people, if they don't feel that they have enough information to make an informed decision, then there's nothing wrong with waiting to make that decision. Nothing wrong at all with waiting to make that decision. And if you decide not to do it, then that's fine, I don't think that it should be compulsory,
Definitely.
I know that some work Exactly. And, I know that some workplaces will have a policy in place to say, like with influenza, for example, no, you don't have to get the shot. Like, if you
Yeah.
choose not to, not for medical reasons, but if you choose not to get the shot and you do get sick with influenza, then you're off without pay.
Mm-hmm.
Right? That is some workplaces policies in
Right.
order to mitigate that, to encourage people to get their influenza vaccine.
Yeah. Yeah, they certainly, at least not in Canada, I don't think they can mandate it. I think it would
No.
the repercussions would be too huge for that kind of thing.
Yeah, I mean, yeah, it's
Nor
interesting.
should, and they
thinking
definitely
about-
shouldn't. Like I'm of the opinion
Yeah.
that no such thing should be mandated. I
Right.
would encourage
Yeah.
people to get it. Like I got it, and I would say yes, it's probably
Yep.
the best idea. But if you don't want to, okay, fine, do your thing.
Yep, that's exactly
not so serious
it.
to
Yeah,
me.
I'm not here to fight. It's not, like
Yeah.
you do your thing and I'll do my thing, and that's totally fine. Yeah, it's
Yeah, and
interesting
we'll
because
both
they're
suffer
talking
the
about
consequences of it. You know? No, like
There-
I mean,
this talk-
we'll suffer our own consequences of what
well,
our choices
exactly.
are. Yeah.
Well, that's exactly what choice brings, is some sort of consequence, whether good or bad, right?
Yeah.
Yeah.
Sorry, what were you gonna say?
I was just gonna mention about like the whole vaccine passport thing. That is it is a normal thing when you're traveling to certain countries, that you have to have, a vaccine passport to prove that you've had specific vaccinations. Like, to go to Africa, you need to have like your malaria shots and stuff. So there is a lot of different vaccinations that are compulsory for when you travel to certain areas of the world.
Sure.
And so that for me is not a big issue. Sure, if I was going to travel to another country and that was a requirement, but I'm still trying to wrap my head around this idea of having vaccine passports for commerce. So to be able to
Yeah.
go and participate in activities, like go to sporting events or go do, like I'm not sure how I feel about the whole situation, because I think that in some ways, it is a very private thing. I think, what you decide to do with your
Sure.
health decisions is your decision. And so, I'm not saying that, it is breaking any privacy laws, but really, is it it's kind of, from an ethics perspective, it is like really nobody's
It's
business.
an interesting point. Yeah. No, it's a
Yeah.
good point. But like I guess it's so complicated, and I think it'll be very messy, right? Because you're also going to very quickly get a market of fake ones, which people will use just to do what they want to do anyway, right?
Yeah, well, exactly.
And then it makes sense from like a private business perspective, where you have to respect that they get to set the rules for their place, and so they get to say, I mean, like just like Costco, like you can't shop at Costco without a membership card. And I mean, it's
Right.
irritating, but they get to say that because it's their business, right? And so there'll be
Absolutely.
businesses that will say you need to have this proof, and and it'll go either fine or not fine based on those decisions, and they'll have to deal with exactly what comes of it, right? And so if
Yeah,
they lose
yeah.
30% of sales because of it, it'll be pretty soon before they get rid of that policy.
Well, that's what it comes
you know.
down to, is the dollars and the cents in some
Yeah.
of these policies. Yeah, I mean, for me, I don't really care. Like, if I have to show that I'm vaccinated, I have no problem showing that. But it's I'm just one individual.
Yeah.
So
No,
you
for
have
sure.
to really think about what is good for the entire society and how practical it would be to implement something. I mean, it's really, it's big. Like, then what vaccines do we then have to show? Like, does it then make it mandatory that you have to have multiple vaccinations to even do your day-to-day business? Like, sure, for me working in a hospital, like if I was to go to another healthcare setting, another hospital, I'd have to do a pre-placement assessment where I would be, they'd have to check all my titers just to see what I am immune to, and if I have to have any boosters, I'll have boosters. I have to get an x-ray to see whether I have tuberculosis, whether it's latent or active, like all sorts of stuff, right? And so that I mean, that makes sense because I'm, in a healthcare position, whereas, to have access to that, like how far does it go? If we start a vaccine passport, how far does it go? How many vaccines do we have to show proof of? And so there's a lot of gray area that I think needs to be discussed and considered. And I guess, we'll see what the decision makers and policy makers go with, and I guess we go from there, right?
Yeah, and we'll just see how it turns out, because they might make decisions that quickly become obviously problems. And we'll just have to deal with whatever it is that comes. Because it would be weird, because can you stop people from buying food because they didn't want to have a vaccine? Or what happens if they had COVID?
Yeah.
Now, what happens if they had COVID? I know there's discussion on whether you need to get vaccinated after you've had COVID, and it's probably, there's arguments on both sides. But it's like, well, then you're going to have COVID passports to go with it, to be like, have you had COVID or have you been vaccinated? Or, it's, if you can't, then you no shopping here. Or it's like, all right, settle down, it's not so, we're not talking about the Black Death or whatever. But some people view it that way. Yeah, the plague. Some people view it that way.
Dead. Yeah.
Yeah. On one of those rolling carts,
Oh gosh.
And they used to wear those masks with the giant horn. Whatever that was for, I have no idea. Oh, I think they used to put spices and things like that inside the horn of the mask, which they believed would, I don't know, help
decrease the
prevent
smell
something
and
or whatever.
protect them from whatever they were facing. Yeah.
Oh my God, the smell, because there were so many dead bodies around. That's horrible to imagine.
I couldn't even imagine, thinking about that time period, just the amount of death, how many people got wiped out from that, to the point where they're actually throwing bodies on cart. Yeah. I
mean, child mortality rates until fairly recently were fairly high. Right, you're people had 6 kids because 2 of them would make it.
Yeah,
which is
exactly.
That's crazy.
And it wasn't even that long ago.
No,
it's still
it was 100 years ago,
right? Yeah,
and it's still true in some places in the world. In underdeveloped places, it's still how it works.
Yeah, you have to.
I mean, what a world we live in, right?
Yeah. Well, and I'm worried for what's happening in India right now. They're going through their second wave, and the variant that is ripping through their country. So this is their second wave, I believe. And the variant that's ripping through their country is just it's bringing so much mass death and turmoil to the country.
It's horrible to see.
They don't have the infrastructure medically. They don't have they just don't have the resources, and so it's really sad to be hearing of any country where there is lots of death as a result of a virus. I mean, it's heartbreaking to see some of the news that's coming out of there. Oh,
it is really terrible, and the mass cremations and the mass burials. It's that's so rough.
It really puts things into perspective as to how fortunate we are to be living in Western society, that we have
100%.
access to hospitals, especially in Canada, with us having universal healthcare, basic healthcare. Having access to healthcare, even though it's not equally distributed, and we have our own problems with that. But we just have so many more resources and options, and we're a more we have more fiscal resources as well. We definitely are a richer society than some of the countries out there, and so count your blessings, because
it's truly
being born
a blessing.
in Canada and living in Canada, we really do have it good in comparison to other places.
Absolutely, and it's easy to lose sight of that if you get mad about vaccine rollouts and things like that. It's okay, but you just take a step back for a second and be like, well, half the world don't have access to anything, vaccines or medical care or otherwise, right? It's okay. You can be frustrated that your vaccine is happening a month or 2 months later than you would like or whatever. But okay, but it's still free. If you start dying, there's people who will take care of you for free. You don't have to worry about that stuff. They're competent, some of the best in the world, and it's readily accessible for a lot of people. Maybe not everyone, but generally speaking. And it is. I do feel blessed to be able to live in such a society, despite its challenges, let's say, which everyone will have.
Oh, yeah, absolutely.
Well, listen, we've just done an hour 40. It has been an absolute pleasure talking to you, as always. You're one of my favorite people. So thank you so much for coming on today, and we'll definitely do another episode sometime.
Yeah, that would be great. I would love that. Thanks for having me.
All right, you take care. Bye.
Okay, bye.